find the providers that truly understand it. You deserve that. And giving yourself the time to rest without apology, like give your body the rest that it needs. It's so important. Your body truly does need it. Not that you need to just lay around and do nothing, of course, but it does need more rest. It needs more nervous system recovery time for sure. They're different. We're like orchids versus dandelions.
Hey, beautiful soul, and welcome to Dear Body, I'm Listening, the podcast for women living with chronic illness, invisible symptoms, and the quiet grief of feeling dismissed in your own body. I'm Donna Piper, and here we tell the truth about healing, the messy parts, the hopeful parts, and the parts no one prepared us for. This is a space for real talk, nervous system safe support, and learning to trust your body again, one breath at a time. So on the show today, we have Melissa Koehl. She is a doctor of physical therapy and Pilates instructor based in Chicago, Illinois, with over 24 years of experience. She's a board-certified orthopedic clinical specialist and spent more than a decade co-specializing in vestibular rehab. Today, Melissa runs a virtual and mobile PT practice focused on helping people with symptomatic hypermobility, including Ehlers-Danlos Syndrome. Before launching her own practice, she worked at the University of Illinois Hospital, where she treated patients with complex chronic illness and trauma and taught in their Doctor of Physical Therapy program. After years of struggling with her own mysterious health issues and nearly leaving the profession, Melissa was finally diagnosed with hypermobile Ehlers-Danlos Syndrome. That turning point gave her the clarity and treatment she needed to not only stay in the field, but to build a practice dedicated to helping others like her. So today, I would really like to have this conversation with Dr. Melissa because you may be experiencing the same thing, and the information is always good. So welcome, Dr. Melissa Koehl, to the program. Is there anything you'd like to say? I did your bio officially, but anything more you'd like to add on a personal level today?
Oh, no. Well, thank you. That was a wonderful intro, Donna. I'm glad to be here and excited to chat more about hypermobility.
Great. So can you just give me and the listeners just a little bit of reference or background about your own personal journey with hypermobility, Ehlers-Danlos Syndrome? Am I saying that correctly? I know other people say it differently, EDS.
That sounds right to me. Yeah.
Okay.
They're
good.
two people's names. I don't think they're around anymore to correct us, so that sounds close enough. Yeah. So my background is I've been bendy my whole life. I was a gymnast. I was got benefit from being hypermobile by being, I leaned pretty heavy into all of those bendy poses and did all the things like foot on top of the head and did lots of extreme back bending and those kinds of things. And I did pretty well as a gymnast, but I ended up having a career-ending stress fracture to my lower back when I was about 14, which was a big bummer. But I had quite a lot of physical therapy at the time, throughout my gymnastics career, because I had many other injuries besides just that one. So that was one thing, just growing up, I was pretty confident that I wanted to be a physical therapist because I was really interested in the idea that you could do exercises and move around. I'm like, well, this is pretty cool. I like movement in general, and you can use this to help people feel better. So I got really interested in that just from an early age. But I definitely didn't know anything about EDS or connective tissue disorders or anything like that. It just really it made sense to me that because I was bendy, I might have more injuries. And even going into PT school when I started my career, I was like, no one really was talking about EDS in my program. We had literally one slide, or maybe two at the most. So even though my entire PT school career, when we're learning joint assessments and how to measure mobility, and everyone would remark wow, it was so bendy. And that's really unusual because it is unusual in the PT clinic. Most of the patients that you're working with are stiff, that you run into that. So the instructors were always commenting you'll never see that. And so it never really clicked that I could possibly even have EDS until much later, as I started working as a PT and I started getting so many other health issues that were related to non-joint things. All the joint stuff I knew how to manage on my own from my past and from being a gymnast. I remembered exercises that helped me feel good. As a PT, I knew how to help myself, but all these other GI issues and fatigue and brain fog and so many other things, headaches, like I just didn't know how to manage it or where it was coming from. And it took a long time. I almost had to leave my career as a PT because I was just feeling so unwell for so long until finally it dawned on me that like this hypermobility thing, I looked into it more and was like, you know what, do I actually have EDS? Because I looked into the actual criteria and sure enough, 'cause I think I had a misconception that a lot of people do that like because I never had a lot of joint dislocations. I had little subluxations, I had many injuries, but I never had like a big joint dislocation. So I think it just immediately ruled it out in my head as even a possibility until I just actually dove into the correct diagnostic criteria and was like, it was right there on this piece of paper. Like, oh, I meet all this criteria easily. So that changed how I think about everything.
That's really interesting because I think I had the same experience. I was a dancer and being around gymnasts and everything. There's a lot more people that look like you that, may have a level of hypermobility. So when you said that when you got into PT school, people actually, you're more of an anomaly how you move other than because my assumption is most people could bend their fingers back, like it's not a big deal because I was the same. I didn't have my joints didn't slip out. So I was like, oh, well, I don't have any, it's not really affecting me. But all of the other symptoms that you were talking about, mast cell, brain fog, all those things, is that why you decided to create a program like Ground Control to help women? So I put that out of context, but Ground Control is Melissa's signature program. That's how I got really more involved with Melissa is through this program where she really talks about how to look at movement through different lenses when you're hypermobile and all the things that come with it. It was so eye-opening and it was illuminated things that I didn't even know, like riding in a car would give me maybe some symptoms, and learning how to move my body differently through this program has been life-changing. So can we talk about why you created or what was your aha moment to create Ground Control?
Oh, yeah. I don't know if there's one exact aha moment. I had the idea for it quite a while because I had figured out on my own from being a PT, like how to manage a lot of pains and things that came up for me regularly. Like, I knew if I did something, I got a massage and my neck got triggered and I had arm pain, I knew exactly what to do because I was a PT and I knew how to manage it. I had all of these tools and all of that background that it was always in the back of my head, like everyone should know some of this. Maybe not every single thing, how to manage every single injury you've ever had, but if you're bendy and you're injury prone and your connective tissue has some issues, like there's some baseline things that all of us really should know. And it's always been my dream. I think maybe a future project would be like a class for like a gym class for junior high school kids that would teach them these fundamentals. Like you get screened just like kids get screened for scoliosis. They also like, well, how hard would that be to also screen for hypermobility and be like, here, shuffle you over to this class, like these special movement and connective tissue where you would learn about mast cells and learn about dysautonomia, learn how to like identify signs of things early, learn how to move well. Like that would be my ideal dream. But knowing that is like a bigger project and maybe too late for a lot of people who are already adults, I wanted to have something that was as like a very fundamental thing that would help people be able to help themselves as much as possible. Because I know not everyone can get to a PT at the drop of a hat or have access to a good PT that understands or have PT for an extended amount of time because you may only get it for just your ankle injury or just your shoulder injury and then off you go. So I felt like there was a big need for something that was more comprehensive that gave brought up everyone's level of understanding of how to move in this bendy body. So you have this baseline that you could start from. You're starting from a much better place. And then if things pop up on top of that, you deal with that. But yeah, that's kind of the short story of like where that came from.
Well, that's a beautiful vision because I know for all of my issues, because I have like 5 of these chronic illnesses, I have lipedema, which is a connective tissue disorder, and others, and then mast cell activation syndrome, hypermobility, EDS, and POTS, and chronic fatigue. So there's so many, and they all have an overlapping with those more I don't know what to call them. Maybe you could tell me that. I call them more soft symptoms. It's like, it's the daily, like, it's hard to search for words some days, or I have a headache, and all of these things, those collective symptoms that you said were on maybe on a piece of
Yeah.
paper when you like went to get diagnosed.
Mhm.
Can you talk about some of the things that, if whoever's listening to this podcast, and if they think they might have it, or if they have a friend or a niece or someone, what are some common, along that idea of just giving some basic information that most people should know, what are some things you would like to tell to people, a few points about what to look for or how to live in the body, or if you have anything? That's kind of a huge question, but anything that comes to mind.
Yeah, I think a big thing is understanding one, that your body shouldn't be in pain all the time. I think a lot of people get used to the idea because they've been brushed off, or they have so many aches, pains that kind of come and go and change body parts, and it gets relatively dismissed. And not to say that your body is going to always be like that, but that's not something you have to just live with it, and just, it's not in your head. That there is usually an explanation for that. If it's a connective tissue disorder, that makes perfect sense, and you may need to do certain things to address it. So it's not something that you need to just like accept, like, I'm just going to have pain all over the place, and that's that. The other thing is like the fatigue, I think, is a huge one that's underappreciated and is a hugely common symptom of hypermobility. I have yet to meet a patient or client of mine that doesn't struggle with it in a very serious way. I know it's probably not everybody, but I think the most recent research off the top of my head is something in the 80-ish% of people with HEDS complain of fatigue. And can be very impactful in someone's life. And that alone might be a sign that you have a connective tissue disorder. The fact that the fatigue is there and it's so omnipresent or so significant, that really warrants looking into a little bit more, and isn't something, again, just like the pain, it isn't something that you need to just accept or live with. Because I feel like when people start thinking of hypermobility, at least from like standard medical training, you think of this, the joint dislocations, maybe the stretchy skin, and they may not even think to ask about these other symptoms. If you just ask someone, hey, what else is going on with you? They may not even volunteer the information because it's been so like flying under the radar for most providers. So they don't have an answer. So they're like, I'm not going to mention my neck always hurts, and I am always tired, and I pretty much always have a headache, and I'm constantly bloated. GI symptoms are like the next one after fatigue that I really like to dive into with people, because like that's not normal either, to just be bloated all the time, or constantly having issues with diarrhea and constipation or abdominal pain. Like, but people struggle with it for so long without getting an answer that eventually they kind of stop bringing it up.
Yeah, it really does kind of, I think, just for my own experience, you just need to normalize it a little bit. Like, oh, this is just part of my life, especially if you've gone to people for answers and you don't really get many answers with it. Could we dive in a little bit more about like maybe why the fatigue is so prevalent? Is there some science and some things that happen, like, that goes on to make women or men that have hypermobility? And is it more prevalent in men and women, or is that an issue?
Yeah, well, we know hypermobility is in general more common in women. How severely it affects women versus men in terms of like the symptomatic form, that would be an interesting study. I don't know that we know that. I feel like some men are underrepresented in the diagnostic current criteria. There's even some talk that maybe men and women should have different diagnostic criteria because their joints are different. They tend to not be as hypermobile, so sometimes they get missed. And their experience may be slightly different. Obviously, like their hormones affect things as well. Like there's some protective aspects of testosterone for muscle mass and even energy and things like that. So that is one difference. But to your point of like where the fatigue comes from, I wish I had a simple solution, because there's so many factors that are part of it, right? So if we just take like the GI aspect of it, if we have chronic GI issues, your GI your gut is a tube made of connective tissue. And if it's extra lax, there's going to be issues with motility, with just the food moving properly from one end to the other. There can be issues with absorption because of inflammation. There can be leaky gut because like if the cells are loose, it makes sense that things be looser there. And then you get triggers to autoimmunity or immune system reactions to food. So you create all that creates inflammation, and then you don't absorb nutrients. So there's like nutrient deficiencies that can be going on causing fatigue. There can be just generalized inflammation tends to be a big one that I see over and over again in multiple systems. More studies are coming out looking at like the amount of inflammation and mast cell driven inflammation that's in various parts of the body, and that very well can drive fatigue in a very big way. In fact, some of the research on long COVID has been considering it's more complex, but also considering the role of like these mast cells and chronic inflammation driving overall brain fog, fatigue. That can be a big factor. And then we also have like dysautonomia is really common. So autonomic nervous system, which controls our heart rate, our blood pressure, sweating, your GI system. There's a number of things that can be going wrong with that. Like you mentioned, POTS is the most common one, postural orthostatic tachycardia syndrome. And a key feature of that is what we see is blood pooling in the extremities, because it's thought to be either vessels are loose and things are pooling in the legs and in the pelvis, and or mast cells are driving the expansion of the blood cells as well. Mast cells releasing different mediators, like histamine is a vasodilator, which can then trigger blood pooling in the extremities. And if more of your blood is hanging out in your feet and at the bottom of your pelvis, not as much as getting back up to your heart and up to your head. And that's a big driver of brain fog and fatigue as well. So those are just a few. And most people have a combination of all of those things going on, and you have no idea. And also you're just like, I'm so tired all the time and I'm not sleeping. You might have sleep apnea. That's also very common in this population, even though you're a young, thin female, because things are so lax in the airway. You can be not getting enough oxygen at night. That's not giving you restorative sleep. That's making you fatigued. So those are just a few to mention.
I mean, it is kind of mind blowing, but it's just thinking about how much energy the body takes just to properly function with all that going on, with all the different sort of nuances that it has to play with if things aren't properly going down how it should. No wonder. I mean, just might make you tired as well. And I know I've had a lot of chronic pain, which now I know it's more related to the hypermobility. I didn't know. I just thought that I was just a person with migraines and pain constantly. And since I've had migraines since I was 7, all the doctors, I mean, I saw very like fancy functional doctors for years, and no one associated my migraines with my hypermobility through all of this. And just until recently, I have only gotten a diagnosis like in a year and a half ago with all these things. And I'm 54. And I've been to many doctors with GI stuff, and they didn't connect the GI with the hypermobility, which I think is very interesting. But going back to the fatigue with all of those things going on, that the connective tissue is really the driving factor in all of these symptoms, correct? Because how it works, it shows up internally throughout your body, not just how you could see, like if your knees are locked or if your joints go, that is really what you manage. And I'm really impressed in your ground control program that you have a lot of this information there and how much support you need. And I want you to talk about it more, but the idea that when you have a more bendy, hypermobile body, or with all of these things, that slowing down and resting are very much a part of their program. And it's a different sort of paradigm shift for modern people, like do more, exercise more. And many of you that have listened to me and know that was most of even though I was a dancer, as a Pilates instructor, I ran marathons, I did weight training, I was always active, I ate really clean, no sugar, blah, blah, blah. And when I would go to doctors, especially when my lipedema was getting worse, they would say, well, maybe you should eat less and move more or get some more rest. Yeah. And it wasn't ever really addressed. Or maybe you're really not eating like you say, there was a lot of that. So with like your ground control and even it was kind of a shift, especially with the chronic fatigue. And you mentioned long COVID, those have some overlaps with them. And that's probably a whole other conversation. Yeah. But really, can you talk a little bit about why rest or taking it slower is much more productive for a bendy body or hypermobile body?
Yeah. Oh, that's a really good point. I'm glad you brought that up because it's really common, I find, in this population for people to be overachievers, right? It's not always, some are under, everyone's, it's a spectrum, but very often, especially if you've been an athlete and you've leaned into those things as a dancer, a gymnast, swimmer, musician, whatever the case may be, there's a big overlap between hypermobility and neurodivergence as well, which is really like potentially there's another avenue for this where there's like a certain drive to get involved in something and really challenge yourself and push yourself. And it may have served you for a certain amount of time well. And it's kind of hard to unlearn that later down the road, even if your body is protesting, even though it's like, you know what, you have absolutely reached the limit of what you can do. It feels incorrect to not challenge yourself to the max. It feels like, well, what's the point of doing this if I'm not going to like sweat or feel like I'm sore the next day or things like that. But if we think of it, like you said, about the connective tissue part of things, it's not just your muscles that you're working out. When we move, it's the tendons and the ligaments and the fascia. All of it needs to repair. And when we do exercise, it's a stimulus intended to break the body down, right? Like in a very specific way. Like I'm literally going to make these micro tears in these muscles and in these tendons with the goal of it repairing itself. And if we do that too quickly, faster than your body can regenerate itself, and if there's already a connective tissue disorder, meaning it takes longer for those connective tissue cells to repair themselves, it makes sense the more you just hit yourself, hit with that exercise stimulus, if you're not giving it time for that repair, it ends up becoming a downward spiral rather than an upward spiral where you're actually building. So you have to like give your body the time to repair between sessions and respect like the energy level that can like be a wave that you're riding, to understand what kind of, from a cellular perspective, what your mitochondria and your ATP, how much energy they can effectively produce on any given day. So it's like, it's not that people need to like go low and never work out hard again. Cause I feel like that's like sometimes the barrier to thinking this way. It's the like, well, I don't want to just do nothing. Like that just feels like that sucks, but if you think of it as like, well, this is the step to get you back to doing the higher level stuff that you want to do. It's like you have to like take just a couple steps back in order to be able to more effectively step forward. And it's a hard lesson. I've had to learn it myself, like literally like a million times over by doing it wrong and just wiping myself out, injuring myself like over and over and over again, and convincing yourself, well, this time will be different. And it never is until you finally learn. And same with working with patients too. I feel like when you go to a PT and they give you too much to do, again, everyone's different. So what too much is relative. But if once you start working with this patient population, it becomes very obvious that everyone needs to start just like with so much lower intensity, lower volume. And that just is so much more effective than just trying to start at the finish line.
Is there a lot of PTs that are aware of hypermobility and have these? I mean, I know your program is very specialized and it's great because it is online and people can get to it. And then, after ground control, she has a program called It's So Easy, which I'm also in, which is a really nice supplement and a progression. But my experience has I was in what I consider the health and fitness industry forever. And I wasn't looking for it because I figured hypermobile, I didn't have symptoms, but I would have never considered myself being able to be diagnosed with this either. Is there more PTs that is it still kind of relatively a small group, or are people knowing about it a little bit more?
I don't have data to say how many are out there because there isn't any official credentialing to say, hey, you're a hypermobility specialist PT. There isn't a certification or a board certification in that at all. In fact, I think the closest thing in the PT world we have is the orthopedic clinical specialist exam. You have to PT for 5 years, and then you can take this very comprehensive exam. When I took it, in 2008, it didn't mention hypermobility once at all.
Okay.
Right? This is a long time ago. This was 2008, and next round, eventually they changed the way they recertify people. I'll have to redo the test at some point. So I'll be curious to see if they even put it on there at all, because those are the type of PTs that most hypermobile people would end up with are orthopedic specialists rather than unless you're a kid, then maybe a pediatric therapist might be more aware. I think thankfully with just the internet, social media, things like that, people being just patients and providers like me that are just sharing information. It's definitely getting out there more, and there are more providers than ever before. So it's not like there's none. And the EDS Society website is always like a good place to search if someone's looking, like, how do I even find somebody? That website has a provider search, and that's usually a pretty good place to start. Or local Facebook groups, EDS Facebook support groups. That's usually a good place to look, just who's good, who's available, who's seeing clients, who didn't move away. Those are pretty up to date on those things. But outside of that, it can be tricky. Like, it can be hard to find people that really understand this in depth, because you really need to take the time and the initiative to learn it separately from what's kind of being taught in most standard PT programs and medical schools. And like, there's not a standardized way to learn this kind of information outside of the EDS Society, their program for providers, which I highly recommend to anyone who's a provider out there. Yeah.
So I know with some of my other things, there's some more stigmas, or that's like, especially chronic fatigue, like most doctors, is it really a thing? Is it kind of made up? With hypermobility in the PT world, or I don't know if you cross over with OTs as well, is it something like the teachers and people that are teaching new physical therapists, is it even on their radar as something that is a potential diagnosis for people because they're not really taught it and it wasn't even on your test? Is there a stigma like, oh, it's really not a thing? Or kind of from the PT, like your teachers and how they taught it with that? When you became like diagnosed with it, did people like, oh, did they, I guess believe is not the correct word, but you know what I'm trying to say, right?
Okay. Yeah. I think it depends on the program, in how invested the instructors at that program are in this. It's like a sub area of PT. So if someone in their program that's an instructor has EDS, they're probably going to learn a lot about it. Or like has a family member. For example, I know a couple of schools are doing a much better job. I wish I could remember. There is a school in Wisconsin, because I was complaining about this on social media one day, like, oh, what schools are out there doing something? And some student was like, my school's good. And I want to say it's University of Wisconsin-Madison, but I'll get back to you. But apparently they have like a more in-depth entry-level education on that. And there's been a few PT students that have reached out to me that I've worked with that as they're finishing up their doctorate, they have used hypermobility as part of like their case report, or a paper that they've written for one of their classes, or given presentations, or a lunch and learn. Like, there are definitely people that are in PT school that I know for facts, they've asked me for like some consultation on what they should talk about. So I know that there's people out there trying to get it more mainstream into these programs. The trouble is, like, with any education like that, is like, once you add something new, then they have to take something away. And that's where I think the problem is like, there's already so much in here that's required, and what's on the boards, and, like, what do we remove if we spend more time on this? Like, I don't know. I feel like there's definitely room for at least a little something, a little bit more without sacrificing too much, but there's definitely room for a lot more, even though it is getting better for sure. But yeah.
Because it seems to be pretty prevalent. It's not just like, a very small group of people that you come across. I mean, as you kind of look at, especially because there is, and maybe you would probably know the words better for this, but EDS has at least 13 subcategories, correct, of that. And then there is hypermobility spectrum disorder, which is part HSD, and then there's hypermobile. But I think whatever that range, just kind of as a very layman, if you have some connective tissue that makes you hypermobile in some way, you might be subject to any or all of these. And the strange thing is, with all of this, it's just because you're hypermobile, you might have a degree of one or the other. You don't have to have necessarily POTS or MCAS, you usually do, but the severity of how it affects your life is a full range, which makes it tricky, I think.
Yeah, completely. There's a misconception that hypermobility spectrum disorder is a lesser than diagnosis than hypermobile EDS, that it's like a milder form, when in fact they're two like completely overlapping things. And there's a lot of debate as to whether they are different in any way. Is the way the criteria is set up right now, the only really clear differentiation is to meet the HEDS criteria, there are a few other non-joint signs that you have to meet, like a certain number of things, like you get stretchy skin and atrophic scars and a high narrow palate, things like a prolapse, like either organ prolapse or mitral valve prolapse, a couple of other signs of connective tissue disorders in the body. So like once you meet a cutoff of that, that gives you the sign, that gives you the official diagnosis of hypermobile EDS versus hypermobility spectrum disorder. But there's many experts will argue that it's kind of arbitrary because symptomatically, like when they're treating these people in the clinic, they're the same, right? Like even though this group has the scars and maybe their skin's a little more fragile, but these people have just as bad dysautonomia and POTS in their mast cell or upper cervical instability. Like they can be just as severe, if not worse, someone with HSD struggling big time, whereas someone with hypermobile EDS can be like, I'm actually pretty okay, other than, I do have a few joints that, that I have some pain or I sublux here and there, and I'm a little fatigued, but generally I'm like living my life, and vice versa. So like they're both a spectrum, and we don't at this point have any like really clear definition of like, how are they acutely different? It'll be interesting to see like how research changes over time as they look more into the genetics of all of this and the like on a cellular level. But yeah, right now I think it's important that people understand, like if you have HSD or if you're just have multiple joints that are hypermobile and you're having other systemic things going on in your body that aren't making sense, that there's a good chance that you have hypermobility spectrum disorder or hypermobile EDS, and both are equally as valid of a reason to explain some of this.
And now what is your kind of feeling and stance on getting diagnosed? Self-diagnosis versus an official diagnosis.
Yeah.
And I mean, going to the EDS website would be a good place to find maybe your provider, but I've heard different stories that it could be kind of challenging to find even providers that will send you to a reference to get diagnosis. So what is your take on all the diagnosis part of it? Does it matter if you're hypermobile? Fine.
Yeah.
Like join ground control and it'll help you no matter what. Because you need, because you're really looking for some relief of these symptoms. So.
Right. In general, I'm a fan of getting diagnosed if you can, for a number of reasons. I know it's not always practical. You can definitely get help and start moving in the right direction by working with providers, whether or not you have an official diagnosis or not. Most can work as if you potentially have this going on and start treating you appropriately if they understand, right? My main thing with that diagnosis is being vocal about it and advocating for yourself for it. If you have the energy to do that, it helps from a micro level. It's an advocacy type of tool where you're bringing it up, you're talking to providers, people that may not have considered the idea that, hey, this is really truly a spectrum, and I'm one of the data points on this spectrum, that it can look like this, it can look like this, it can look like this. You're just starting to, for each provider that you encounter, once they see it on your record, they start to put two and two together, and it might help other people get recognized down the road too, because they'll realize, like, you know what, not necessarily everyone with EDS isn't necessarily going to come in here covered with braces on their body. They could, but there's also other versions of this that are out there. So from that perspective, I think it's a good thing. I do think it opens up doors towards other care that you may not be able to get, again, depending where you're at, because, sometimes people will treat you regardless, but it does seem to give you a little bit more access to treatment of the co-conditions. If someone already understands that you have hypermobile EDS, it can help you with things like surgeries. If your surgeons and the surgical team knows that you have a connective tissue disorder, and you can talk to them ahead of time to be more careful with your neck and your airway and thinking about what kind of sutures they're going to use and protecting your immune system so that you don't have like a big mast cell flare from the surgery. Like those kind of things can be really helpful. So there's like a lot of benefits, although it is a little tricky because you have to just like take the time and find providers that understand how to appropriately make the diagnosis, which isn't easy. So that's, from an energetic standpoint, it can be a lot or costly depending on your insurance. So that's kind of the bigger downside, is just like the amount of time and effort that it takes to get it done.
And and I'm not holding you to this, just in general, once you do get a diagnosis and you get a referral to a PT, does your PT referral, I know sometimes people only have 6, or if you have an injury, is there a referral process to work with the PT once you get diagnosed? Or is it more just to have that on your record so, the anesthesia or whatever is with the surgeries that you're talking about might be or maybe your recovery time might be a little longer if you have surgery and this and that.
It would
Or
be
is there?
individual. Yeah. So if
Okay.
you are going in and with joint pain that needs addressed with a PT, then that might be a one step. Like, okay, here's the diagnosis. You get the diagnosis code of hypermobility or hypermobility spectrum disorders that goes in your record. So then that may help the PT be able to justify more visits from your insurance. So if it says your diagnosis code is hypermobile EDS, again, every insurance is different, so I can't say how it all
Yeah.
works. But if you have that versus, low back pain, you may be able to get more visits covered when you're like, okay, well, I came in here, my primary thing today was low back pain, but actually now 2 weeks later, now it's my shoulder and now it's my neck and now I just sprained my ankle. You may have more freedom to treat the whole body with that appropriate diagnosis versus if you have the diagnosis, it just says, M24.5, whatever the code for low back pain is, and then you're treating the neck and you haven't documented it appropriately about how one justifies treating the other, and it gets complicated. So there's a little bit of insurance
Well, that does help, especially
game.
for a
Yeah.
motivator to go through the energy. Because when you do have brain fog and you are tired and dealing with all of these steps, it can be overwhelming. And I'm just remembering, I think you have a program that talks people through this. Or do you have something, a resource for?
Yeah.
Sorry, go.
I do. Right. I have a course called Navigating Healthcare as a Hypermobile Human. So it's designed because I'm sure you went through this, Donna, as you started to put 2 and 2 together with hypermobility. It's like drinking from a fire hose. Like, whoa, first of all, your mind's blown. Like, how did no one figure this out until now? And then also like, wait, that's part of hypermobility and this symptom has to do with it. And wait, what about, my headaches and my problems with my pelvic floor and my TMJ and my, like my sleep apnea is part of this. Like, it starts to get a little bit overwhelming. So I put together a course that is ideally like teaching the nuances of what you need to know, but not overwhelming to a point, because you could go on, this could be a whole master's program of learning all of this stuff. So I kind of put together the biggest dial mover things that I end up spending most time with my clients one-on-one. Like as PTs, we have the luxury of spending more time with people and not just doing exercises. Like while we're doing exercises, we're talking about their fatigue and their diet and their sleep, and all of these things. So, and helping them figure out what other providers they should see, how to talk to them appropriately, what kind of tests to ask for. Like that's a big part of our role as PTs to kind of like, we have this luxury to be like, hey, I speak the medical lingo. Let me help you out in terms of like figuring out who you should talk to and what to ask for. So yeah, so I have a program it's a DIY program that talks you through, symptoms to look for, testing for mast cell, dysautonomia, MECFS, upper cervical instability.
That's huge.
Kind of all these common things.
That's amazing. Like, so anyone that's interested in that, I will leave all of Melissa's resources linked to the show notes and how to get in touch with her in a little bit. But just that, to know the language of what to say in order to get like a referral to someone is huge, because there are some magic words out there in the world of medicine. Like you could say the same thing, but if you don't say the right word, that's like, oh, I could refer that, or I could use this to substantiate a referral or justify a referral. Like that is like a really necessary resource, 100%.
Yeah.
So
it's helpful especially because doctor's visits are 5 minutes, 10 minutes. It's so short. There's such a limited opportunity to get your point across of what you're trying to get out of that visit. So if you know how to maximize that time and say what you need to say to get the outcome that you're looking for, it definitely helps save a little bit of the medical trauma that happens.
Yeah, because that is a real thing too. So what wonderful resources that you've created for this vision to really help all of us out that have these complex things, because you might come through a mast cell, you might get diagnosed with mast cell and then realize that it's your connective tissue as well. Or, there's so many different inroads to this, or you just have a gut issue. And then so by really understanding all the different avenues that may lead to you have a connective tissue disorder that really needs to be worked with is huge. So I'm going to just ask you a couple last questions as we finish up. But what is the one thing you wish every woman living with a complex or misunderstood condition could hear and believe? So if anyone like, what's your kind of sage advice to anyone just living with these complex conditions, to have them understand about themselves or their body or their role or anything you like to? It's kind of off the cuff. So whatever you want to say is perfect.
I think the one important thing that everyone benefits from hearing is that it's not your fault, right? There's so many people, like you had said, that are told, oh, if you just eat a little bit better, if you were to exercise more, this would all be better. And 99% of the people that I work with have already done all that. If you had a normal connective tissue, a collagen normative body, you would be like the master at training everyone around you and how to lead a healthy lifestyle and how to feel phenomenal. And I'll give a perfect example. My husband went on a health kick a month ago, just changed a few things. And he's like, I feel amazing. And I'm very happy for him. I'm very happy. It's wonderful. And I'm like, but there's still a little part of me. It's like, I got to do all that all the time. And I have been for years and it's still a struggle. I'm way better than it was, but it's not a matter of just doing what average people do to be healthy. You have to do that. That's a baseline. You can't not sleep and eat garbage and whatever. But there's extra. There's definitely extra things that need to be considered with a connective tissue issue. It is more challenging, and giving yourself the time to find the providers that truly understand it. You deserve that. And giving yourself the time to rest without apology, give your body the rest that it needs. It's so important. Your body truly does need it. Not that you need to just lay around and do nothing, of course, but it does need more rest. It needs more nervous system recovery time for sure. They're different. We're like orchids versus dandelions. I like to think of it.
I love that. Yeah. And I'm so happy that you said that. Just it says it's so true. It's I've had the same experience where my husband might change one or two things and I've changed a million of those things and I don't waver and I don't have that euphoria of oh, I changed these things, I feel fantastic. And then 10 other people are like, oh, I just did this one thing for 20 minutes and all this is, I'm just fine. So it's what? So I love that you say that. That kind of paradigm and that way of looking at wellness does not work for complex issues at all. It's there's two different roadmaps, right? Or ways of being that they don't intersect like that. And it's not as easy. It is challenging. So I like that you really say that to give yourself time and patience with really figuring it out. And one last thing, what is one truth, insight, or piece of knowledge that you personally, if you would have had known it earlier, could have helped you move forward or faster on your healing journey? So if anyone out there, because I know that I do this podcast so people have information to maybe find a little nugget that's going to help them go a little bit quicker on their journey, since mine was over 20 plus 30 years to get diagnosed with anything. Is there one thing that you were someone would have told me this 20 years ago that would have kind of made my journey a little easier or faster to get where I needed to go?
I think it would be that you don't need joint dislocations to have connective tissue disorder. If I had known just that one thing, which I really, truly didn't understand, that would have changed everything. Because then I would have put together, okay, this hypermobility, subluxations, fatigue, brain fog, GI issues, all of those things paint a very clear picture. And you don't need to necessarily be someone that's dislocating left, right, and center or needs a bunch of braces to hold yourself together. There are people that are in that situation, but there's a spectrum, and the middle and the far end still deserve just as much attention.
Oh, I love that. That's so great. Well, thank you so much for having this conversation. It was very informative for me, and I think anyone listening. So is there any place you hang out or you would like to tell people where to find you that you always connect with, whether it's Instagram or another social media or your website? Do you have any?
Sure. Yeah. Let's see. I'm usually here hanging out in my house. But don't come here.
Address will be in the show notes. So you can be like, is this
here with my cat? This is it. Right. So yeah, I'm virtual business. Yes, I'm on Instagram a lot at dr.melissa.koehl.pt. I'm also on TikTok, which I am not as great about posting there, but usually it's most of the stuff I put on Instagram. I just throw it on TikTok. I have a YouTube channel that's got some exercise videos and some educational stuff on there. I'm building that. Those are the main places. Yeah.
And I didn't mention this at the beginning, but your business is, I might butcher the name, Chimera Health. Is that correct? Chimera.
Yeah.
Okay. Sorry.
Yeah, that's my business name. It's a mythological beast from Greek mythology. It's a hybrid creature with the head of a lion and the tail is a snake. And then it also has a goat head sticking out of it. So it's like this hybrid creature. So that like represents my hybrid approach to health and fitness. And I just like things that are fantasy based, sci-fi, kind of anything imaginative like that. So that's my company's name. It's just my small little company.
Well, it does a lot of beautiful work, and it's like, I know it's helped me, and I know all the students that you have through ground control and all the other various, like, it's so easy that you've helped a lot of people just kind of understand and just kind of get a baseline. And if nothing else, it's like, oh gosh, I'm not crazy. These symptoms are just not normal, and there's a way to manage them. So symptom management is huge. Like, you don't have to be in pain all the time, and just being told that that's not really normal to have bloating and all these things is like, you just don't have to live with it. There's things that you can do to start addressing that is such a gift, truly. So I'll leave her links to that. I think also you have some cool shirts and merchandise, so check out her website. Definitely, if you think that you are any hypermobile, or even if you're not, that you have some of these things, bloating, brain fog, the workout truly and your approach to working out changes. Because I've had certifications and master's program and all these things about fitness, but I never really addressed hypermobility because I didn't think it was an issue, because it wasn't, like you said, a major issue. So just changing how I view my body with a connective tissue issue is changed how I move and changed my pain levels. So this is for anyone out there, or a friend that you have that you know that's like has these chronic headaches and are tired all the time. Maybe they need to check out Dr. Melissa. That could be like a key. Or if they start working out and they get injured or fatigue, or they have 2 good workouts during the week and then they can't show up to the gym, it's not because they're lazy. Their body's probably responding to being overactivated. Correct?
Mm-hmm. Right. Yeah. Just above and beyond its capacity. It needed more time for recovery, or...
Yeah. So thank you again so much. And I highly encourage everyone to check Dr. Melissa out. And until next time, I hope you guys have a good week. Thanks for listening to Dear Body, I'm Listening. If this episode helped you feel a little more seen, a little more steady, or a little less alone in what your body has been carrying, share it with someone who might need that too. And remember, there's nothing wrong with you. You've just been living in a body that hasn't been understood. Until next time, keep listening gently.